Yeah, sure, ma'am. You can go ahead with the lecture. So, if we have any questions, we can ask it later on.
Yeah. Regarding, you can say me anything when I am teaching you. You have any confusion? I can tell you again and again regarding this one thing. And which thing we have done before, and that is in now previous one. In the end, you can ask that one thing, because I think so. We have to complete it. There are so many people who are want to see what will become, what will be in the end, and what will be result. What do you say? Is it?
Yes, ma'am. That's right.
And kindly, you
Everyone, if
must.
anybody have any question, if anyone have any question, you can type it on the message box and ask at the end of the lecture. So that's more visible for everyone. Once Miss Maria, Dr. Maria complete the lecture, then you can ask any question. Just write your question in the message box and you can ask at the end of the lecture. That's fine for
And if
everyone?
there is any confusion, you can ask at that time also.
Yes.
And second thing is that kindly must apply on yourself also, and in the end must tell about your views also. Because if there is any kind of difficulty, any kind of things you are feeling or you are facing, you have to tell me. We will resolve in this time also, inshallah ta'ala. Okay, I start again. First of all, we have make karate chop, and here on karate chop, we phrased 3 times statement, and we tapped how many times we don't know. Just our focus was that we have to tap on it, and we have to phrase 3 times. We phrase 3 times, even though I have fatness, I accept myself as I am. I am tapping on this one base. This is basically karate chop. Even though I have fatness, I accept myself as I am. Even though I have fatness, I accept myself as I am. I tapped so many times. I didn't count, but I phrased 3 times. Now I will start from my head. I will tap 7 times. I will count it, and I will phrase. It is up to me how many times over there. Now I will take only that one symptom name, not full statement. I will take only one statement word over there. I will speak one word like that. Fatness, 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 7 times from here till half head. There is basically pressure points. That's why I will cover over there. Then I will come over there in the beginning of the eyebrows, and there I will put 2 fingers. Why? Because I want to cover pressure point. I will do it again like that 7 times. I will count from my heart and I will speak from my mouth. Fatness, 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 fatness. Then end of the eye. Fatness, 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 fatness. And then under the eye. Fatness, 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 fatness. Then under the nose. Fatness, 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 fatness. Then on the chin, under the lip. Fatness, 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 fatness. And then collarbone. I told you V is there, and 1 inch left side you down. There is basically I can do with my 2 hands also, because both sides there are pressure points, and one by one I could also. I am using my both hands. I will tap over here. Fatness, 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 fatness. 7 times I did it. Then under the armpit. Under the armpit, 4 fingers will put over there, and when your forefinger is going to finish, there is basically pressure point, and you use your basically after that one 4 fingers together. Because why? If there is any kind of pressure point is going up and down, it will be you can easily for you locate it, and you will put over there your pressure 4 times. 7 times you will do it with your 4 fingers. You will tap over there with your 4 fingers, like under the armpit. Fatness, 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 fatness. And under another one, fatness, 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 fatness. Now come on your hands, and in there here you can see over there, there is basically end of the nail, very starting of the nail, and here is basically you can say that there is skin. This is basically your pressure point. Ma'am, could you share that one slide where his hand, and all could see over there? Yes, Anam Shehzadi, it is really very good therapy. Thank you, Anam Shehzadi. Okay, ma'am, could you share that one slide because they can see easily? We have to
Yeah,
tap over here.
Aap
Uh,
continue. I will share my slides from the other device. So
okay.
I'm going to take 1 minute for this. You can continue. I'm
Okay, it's okay. Just I tell them and they will do it. We will tap over here with our finger. You can put finger straight also and sidewise also, way also. And you have to just cover this one area where nail is going to start it and there is skin. This is basically pressure point. All fingers pressure points are like this. We have to tap over here. First of all, 7 times we have to tap and we have to say our emotion or disease basically fatness, 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 fatness. Then like this, here is also this is basically my index finger. I will do over here fatness, 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 fatness. Then middle finger, I will do same fatness, 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 fatness. In ring finger, there is no pressure point. In little finger, we will do again fatness, 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 fatness. Again, I will do another hand. It is up to you. You do right side or left side first. It is up to you. And if you are going to forget anything, does not mean in the next section when you will do, you can apply over there. It does not affect. Again, you will do over here outside and there is nail is going to started, there is basically skin and that is basically pressure point. You have to push put over there fatness, 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 fatness. Again this finger fatness, 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 fatness. Again middle finger fatness, 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 fatness. And middle finger there is no pressure point, and in the little finger fatness, 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 fatness. And then again you will do karate chop fatness, 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 fatness. Again here fatness, 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 fatness. Okay. After that, there is gamut point. Mostly we don't apply it, but here any person is not feeling any kind of difference at the time. Mostly we apply it, and this is called gamut point. This gamut point is between two fingers. Basically, you can touch your middle, your ring finger and little finger. There is between. This is if you push over there, you can see there is some kind of soft place and you can press it. This is basically your gamut point, and this gamut point you have to utilize it. You tap it continuously and you will say to your client or yourself, you will say open your eye, close your eyes, and then you will say open your eyes. Then you will say look down right side, straight your head, just look down with your eyes right side, and look down your eye with your eyes left side. And then you will say to your client or yourself, rotate your eyes clockwise and anti-clockwise. Your head will be steady like this, you will rotate it and you again. And during this one, all these things you have to say your symptom. This time I am just telling you, that's why now I do it again. And I will say that one symptom continuously, like fatness, 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 closing eyes, open eyes, fatness, 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 and then right side looking fatness, fatness, and left side looking fatness, 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 and moving my eyes clockwise and anti-clockwise, fatness, 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 fatness. If sometimes any person says that I am feeling dizziness, I am feeling nausea, you will say to your client, okay, you put your head steady and you have to see upward, not downward. You have to see upward, upward ceiling side. You have to see. And take deep breath from your nose and exhale it. Inhale from your nose and exhale it from your mouth. You have to do at that time when your client is feeling dizziness. When your client is feeling something, at the time you will do it. Otherwise, you will not do it. Okay, this is basically 9 gamut point, and here after that we will say humming anything any music, any song you like it, you have to say with your just singing it without words. Again, you say one, two, three. Anything which you like it, you have to humming it. And this nine gamut point, basically, this is you can say that one shami point. You did it, and again you will start it from the head till your hands. I quickly do it. Fatness, 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 fatness. 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 Fatness, 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 fatness. Fatness, 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 fatness. Fatness, 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 fatness. You can say that another word, fatty, 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 fatty. Fatness, 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 fatness. Again, fatness, 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 fatness. Take a deep breath from your nose and exhale from your mouth. Now, all of you, tell me, which was your first number? Is it produced? Kindly tell me which was your first number you have given. Is it reduced? Because it must be reduced. If anybody says does not reduced, you have to say okay. On karate chop, you have to again tap over there and you have to say it will be reduced. But it has to be reduced because in each and every client it reduced and till that, for example, it was 9. I say it is now 7. What is coming in my mind? I have to see just that one. I don't have to check anywhere else. Just I have to see that one number which my mind is saying without checking. Until that, we have do it again and again and again. This one procedure till I have to get 0. Sometimes we have less time and client wants to go, and sometimes we have any work. We can leave it. We say, okay, minimum 3 number you have to get it, and after 3 number you can go. You can leave anytime
Ma'am,
also, but it's better you have to get 3 number because you have worked so much over there. Then you have to get result over there also. Kindly,
ma'am,
all of
how
you,
we,
tell me about it. Did you
ma'am,
felt
how
anything?
we actually,
Did you use
ma'am,
any number?
how we actually evaluate or how we actually determine that what number should we give? How
Are you
would we
hearing
actually
me?
know about that?
Dr. Maria, student is asking a question, and a lot of students have the complaint that they are not hear your voice. Did everyone hear Miss Dr. Maria's voice?
Yes. Detected?
Yes, we
Okay,
can listen
okay,
her.
okay. Dr. Maria, you can
My
continue.
voice, are you
If
listening?
anybody, yes, I am
Sometimes
hearing,
it
I am
breaks up.
listening to. But if anybody have the problem, you have to check your internet
My
connection
this one
because
technique has completed. This one session has completed.
okay, Dr. Maria, is
Good.
anybody have
And this thing you have to go again and again with this one procedure till you get 0.
right?
Ma'am, my question is how would we evaluate, how would we determine, how would we actually come to know that what number should we give and uh, I mean, how is it going to decrease? How would we know?
What is coming in your mind? Just you have to say that one. Whatever is
Okay,
coming in your
we
mind.
should go for
Your
our gut
emotions
feeling,
tells
right?
you, because in this time we are not going to check. But when I will complete, yes, our feelings, our emotions, just we will get that one thing, because this is emotional freedom technique. And our emotions tells us this thing is going on. When we will get zero, and after zero, for example, I am doing on weight, I will I will see my weight on weight machine. But first of all, I will forgo on weight machine. I will check my on clothes. I will check my measurement, and before therapy, I also apply if I am going to on weight loss measurement. I check. I say, okay, you check your body by yourself with your clothes. It's beneficial because you have to know, you have to understand that is there any difference or not. Because I have seen many my clients got difference in weight loss at the time in that one day therapy. They reduced their somehow inches and something is there, and few reduce their weight also. Few reduce just few. You can say that 1 kg and 1 pound like that. But one client, I was astonished because very client to client, she reduced 2.5 kg in one time. This very client to client I told you before also, because each and every person has different symptoms, different background, different causes. Sometimes we take that one symptom which is very minute, and sometimes we take that one which is very very precious for that one person. That's why when we have to complete all symptoms, it could take more days, because we have to work one symptom one day. And in the end, marvelous miracle you will see over there, you will see over there. Yes, 7 times Rapunzel, what do you want to say? I think that you are asking about pressure points. We have to tap over there 7 times. We have to count it. It could be more and less, but we want to make busy our mind. That's why in this therapy, we have to set that we have to count it. Thank you very much, dear. You said that it is really too effective. Kindly, any other person who want to ask anything and want to share, all of you kindly must share your feelings regarding this one technique which you have applied on yourself. Thank you, Murtaza.
Ma'am, can we practice EFT on ourselves without a practitioner?
Yes, we, yes, you can. This is really very good. That's why I told you, and I did in front of you on myself.
How much time it will require
When you are
to
going to apply on it,
proceed the EFT?
the thing is that it's very client to client. If you are applying on yourself also, you are also a client of your own self. That's why it could take, you can say that 45 minutes also, and it could take 5 to 10 minutes also. Because sometimes one person is saying, I have 10 very highest point, and in the second time he said zero. It could be. Obviously, it will take 5 to 10 minutes. But if one person is going little bit down, 10, then 9, 8, 7, and you are going this one procedure again and again, obviously it took 45 minutes or more than also. It's very client to client and person to person also, and symptoms, disease to disease also. But
Ma'am,
really, it is really very effective.
is there any
Ma'am, is
suggested
it
or recommended
scientifically
number of
proved?
repetition in one session?
You can apply, but the thing is that who made this one therapy, and there is written in book also. You have to take one symptom. It is better because you know that you are putting so many things over there. You are tapping over there. You are utilizing your pressure points, and they are vibrating so much. At the time when you are going to again and again, it could be make it like dizziness, nausea. That's why you can say that, oh, I'm feeling a low BP and something like that. That's why I think so. One time on one symptom one day, that is better.
Okay, just for the demonstration, you did it twice, right? But we are supposed to give it one try at one session, right?
Yes, one symptom on one person, one symptom you take, and you have to apply on that one day. Otherwise, you can take so many clients because you will be therapist over there. First of all, you have to apply your own self, your relatives, your siblings, and then you can apply on clients. Really, it's so much effective. There is no harm. Even then you
That's
can
very
check
good.
it, and I have worked over there also. In research you can use that because it is really really very effective therapy, and um, you can research on it, and now so many researches have been done on this one therapy within years. Yes,
That's
any other?
really wonderful.
ये आप बताएंगे कि कब करना है ये आपने जो बताया है?
ये आप जब मर्जी करना चाहें. इट इज अप टू यू. जब भी आपको कोई डिजीज, यू आर फेसिंग एनी काइंड ऑफ डिजीज एंड यू वांट टू अप्लाई इट, यू कैन अप्लाई. यू आर फीलिंग एनी काइंड ऑफ डिप्रेशन, स्ट्रेस, you are feeling any kind of nausea, low bp, anything psychological, physiological, any disease you can apply, because physiological diseases also starts with your emotions. When emotions overwhelmed and it is bad negative one, that's why disease starts.
Thank you, ma'am.
Most
That's
welcome, dear.
wonderful, Dr. Maria. I really appreciate the effort that you made in this slide. I myself, as a host, really enjoy the workshop. The way you describe each and everything was really very wonderful. Thank you so much.
Thanks a lot, dear. Thanks a lot, really, it's honored
I
for
thought
me.
everybody, anyone have question they ask already, they asked the question. So I guess we have to conclude today's session.
Thank you.
Everybody,
Yes, it is beneficial for chronic disease also, for each and every disease. One person was asking, sorry, I interrupted you.
no problem at all. No problem at all. You can continue.
Yes, just it's okay, and it is for each and every thing. For depression, for each and every disease, you can apply. Sorry, ma'am, you can conclude it because there was on questions were coming. That's why I was giving answer.
Yes, I am just saying the question was continuously from the different. But I am just asking you that the only 4 or 5 minutes are left with this workshop. So I want to thank you and everybody present there. And I'm also thankful to you. And I have a question, Dr. Maria, that you're asking that we have to deal one emotion at a time. So
Yes.
whenever we have a client, they are with a lot of problem and they are messed up with a lot of emotions. So at a time,
Yes.
it's very difficult for any client to take one emotion and resolve their problem. So how we can convince our client to move one emotion at a time to resolve it
You
first and then
will take
continue with
one
the
emotion, ma'am. The thing is that you will take one symptom, means one disease you will take, and according to that one disease, one symptom you will take. For
next.
example, weight. Weight might be increased due to food. You can take food due to that one, and you can take overall disease also. First of all, you can take overall disease name just like that. I have taken fattiness. You can take that one also, and then you have next day you have to take one symptom due to that this disease developed. According to the client, you have to put over there. You can do, if that client can come morning, evening, you can at that time, because relaxation necessary over there. That person must take relaxation. And there was one question that who has paralysis. Yes, it can apply over there, because my third client was one lady. She was paralyzed. She got accident and her arm was not going upward. At the time, her daughter brought to me and she said that kindly apply this one therapy which you learned. You were saying apply on my mother. I applied. I was on at the time surprised because she could not put her hand upward. When she went, her hand was moving and it was going to back. Really, it is really very good. You can apply anywhere. You have to take one disease. It could be depression, it could be anything. And why this one started, you have to take one symptom of that one. In the
Right.
starting, you can take the name of that one disease. One time you have to apply that one, and in the next day you have to take symptom, reason, cause of that one disease. These things will give relief to those persons, and you will see when they will see difference, they will come to yourself by themselves.
Right, right. Thank you so much, Dr. Maria. I myself
Most
want
welcome,
to
dear.
conclude today's session by thanking you, and I guess another question was asked by somebody else. Dr. Mayu, do you have another class with these topic?
Yes, I will, inshallah ta'ala. And one question was there. Yes, you can apply. The benefit of this therapy is that if any person, paralyzed person, couldn't, you can take permission and you can touch that one person. Or if that person is another gender, you can not touch. You can take relative that one person and you have to teach that one person and say, now you do it, and I am saying by my words. It also apply. And one thing more, it is really very good. You can say that if one person is not in front of you, like your siblings, anyone else, and you are looking, there is something, and might be that person is in stress, you have to take it, that one's symptoms on yourself, and you make it according to that emotion, and you do it on yourself, but you are saying this one thing is you are doing for your sibling. It also affects on them. This is called proxy EFT. It also affects on them.
Right, right. So I hope we have to conclude by saying goodbye to each other. Thank you so much, Dr. Maria. That's really
Most
wonderful
welcome.
meeting.
Thank
And
you, ma'am. And you can, thank you.
Thank you, ma'am.
And you can give this one PPT to them also. They are asking.
okay, okay, I'll share with them. Thank you so much, and everybody take care. Allah Hafiz, and everybody can left the meeting. Thank you so much.